Hey everyone, my name is Fatima, and in this video I'll be talking about the characteristics of benign, borderline, and malignant neoplasms. So when we're talking about benign, borderline, malignant neoplasms, we are basically dividing the tumors based on their biological behavior. Here is a table that summarizes all of the important information that you should mention during your final exam. You should know how these tumors differ from each other based on the differentiation, so the grading basically, the rate of growth, the tendency to metastasize, and something about the microscopy and the macroscopy. It would be very nice if you could give some examples for each of these as well. So starting with benign tumors, these tend to be very well differentiated. So that means there are low-grade tumors. The rate of growth is slow. These tend to be well circumscribed. They are encapsulated often. They are movable lesions because they are not locally invading into structures, and the growth tends to be expansile. They don't tend to metastasize. And under the microscope, you would see uniform nuclei, low nuclear to cytoplasmic ratio, and minimal mitotic activity. Macroscopically, these are well demarcated and necrosis is rare. For malignant tumors, it's a completely different picture. They are poorly differentiated, so they're often high-grade tumors. They are uncircumscribed. They often have a disorganized fast growth pattern. They are immovable because they are locally destructive and invasive. Metastases are common. You would see under the microscope nuclear enlargement, pleomorphism, hyperchromasia, a high nuclear to cytoplasmic ratio because there's high mitotic activity with atypical mitosis. Macroscopically, there would be necrosis, bleeding. There's often no tumor capsule, or there's invasion through the tumor capsule. There could be invasion into surrounding tissue as well. For borderline tumors, it's kind of impossible to predict how the tumor will behave, either in a benign or a malignant fashion. It can be locally aggressive, but it also has the potential to metastasize. So it could be low-grade malignant, it could be potentially malignant. A very good example of these tumors would be the borderline ovarian tumors. And here I've just included an example to really show you the differences between the benign and malignant tumors. So for benign tumors, I have included the example of follicular adenoma of the thyroid gland. This is basically a benign proliferation of follicles, and they are surrounded by a fibrous capsule, and there's no invasion to the capsule. So just looking at it microscopically, you can see that it's pretty well circumscribed. There seem to be some areas of hemorrhage, some focal areas of hemorrhage. But if you look under the microscope, you can see that here is the fibrous capsule, and here is a normal thyroid tissue, and this is the neoplastic thyroid nodule. And you can see that here the follicles tend to be, they're fairly large compared to the follicles here, which tend to be forming like microfollicles. And but you can see that there is no invasion through this capsule that's right here. And that's a hallmark of follicular adenoma. They are usually non-functional tumors. That means they don't produce thyroid hormone, but less commonly they can start secreting thyroid hormone. And the other side, follicular carcinoma, it's a malignant proliferation of follicles, and it's surrounded by a fibrous capsule. You can see that's right here, but there is invasion through the capsule. An important thing to mention here would be that the biopsy for these lesions are done by fine needle aspiration biopsy because the thyroid gland is very highly vascularized and there's high risk of bleeding. This procedure only examines cells and not the capsule. So to distinguish follicular carcinoma from follicular adenoma, you need to visualize the capsule under a microscope. You can't distinguish follicular adenoma from carcinoma by just fine needle aspiration biopsy. And follicular carcinoma is one of the few tumors that metastasize hematogenously. So you should remember that. And these are the references that I used, and that brings us to the end of this video.